President Trump's take on Obamacare. The Trump administration is now moving to allow health insurers to sell lower-cost, less comprehensive medical plans as an alternative to Obamacare. The new rules allow people to purchase short-term insurance for up to 12 months, reversing an Obama administration decision which limited the plans to 3 months. Now, Democrats are fuming over this move. Oregon Senator R-N.Y, for example, is alleging the Trump administration with promoting, quote, junk insurance. Joining us right now to weigh in, and she's brought some props with her. Former Lieutenant Governor of New York State, now senior fellow at the London Center for Policy Research, and a New York Post columnist, Betsy McCaughey. Betsy, good to see you.
Well, thank you.
What do you got there?
This is Obamacare, all 2,572 pages. I couldn't carry in the 40,000 pages of regulations that go along with it.
I can't believe you brought that in.
The key is that the new tax law zeroed out the penalty for failing to have Obamacare-compliant insurance, but President Trump is saying, well, let's give people something else to buy, something that's affordable. So
is this junk insurance? Like the
it is not junk insurance. And in fact, even before this announcement, people were flocking to buy what are called these short-term plans. What are they? Well, they allow insurance companies to underwrite. So it's a much better value for young, healthy people who have been vastly overpaying under Obamacare, because Obamacare forces healthy people to pay the same premiums as very sick people who use 10 times as much insurance. So also it gives consumers a choice of what benefits they want. So a woman with no children doesn't have to pay for pediatric dental care, for example.
Well, that was the issue. You had all this stuff in there that you weren't using, and you had to pay for it under Obamacare.
That's right. So this is urgently needed relief for 8 or 9 million people currently in the Obamacare market who don't get a subsidy to buy that very pricey insurance. They've seen their premiums more than double. They never make it past that huge deductible, so they don't get anything. Right. Now they're going to be able to buy what are called short-term plans and probably renew them under this regulation.
As a small business owner, isn't this a good move, Mike Murphy?
It seems like a good move because, like you say, small businesses were getting choked by Obamacare, by the requirements that were being put on by it. So
the one size fits all.
Right. So this seems like, and I'll still refer to as Miss McCaughey for my days as your doorman. But is there?
Such a polite
I want to hear this story. I forgot that.
You were like 5.
I used to be a doorman, and this was one of my tenants.
So great. That is so great.
And she looks
and look how he cleaned up so well.
No, but you were going to make the point.
Oh, I was just going to say that, listen, this administration is addressing needs of the American people, and you can see it through the IRS payrolls that basically you had 7 million people, latest number we know, that actually opted to pay a fine to the IRS, then have the onerous mandates of Obamacare.
That's
so
right.
this is another way that they're
fine.
So this junk insurance is just it's sad to see that it's still becoming politicized, because we have Nancy Pelosi on a tour talking about taxes. Yeah, exactly. That's what I mean.
Well, that's
so
because Obama tried to label it as junk when he imposed all these new restrictions on consumers and limited what they could buy. Keep an eye also on what's happening in Idaho, because Idaho this week announced that it is simply opening up the individual and small group market. Blue Cross Blue Shield, the first insurer there, that's going to be offering plans that aren't short-term, aren't limited to 12 months, but also will have all of this flexibility in terms of benefits. They will have medical underwriting. Their plans are going to cost about 50% of what Obamacare costs.
Just real quickly, though, and I can't believe I'll agree with Nancy Pelosi on this, that some of these insurers, though, they operate in a sleazy way. And when they start selling these short-term plans to people, they're not real upfront about what people are buying. And I've witnessed this firsthand, where somebody buys a short-term plan and they didn't know it was a short-term plan.
But
so that's up to the state insurance regulators.
True, and also look at the HHS regulations that are being examined right now, because they do make it clear what insurance companies have to very visibly disclose to consumers. But the assumption is here that the American people are smarter than the bureaucrats in Washington who are ramming this one-size-fits-all, very expensive plan down their throats.
Yeah, and now that I see what it looks like, I'm sure that they didn't read it.
Believe me.
I'm sure that they didn't read it.
No.
Betsy, great to see you.
Thank you.
Thank you so much. Thanks for lugging that all over here, too. Betsy McCaughey joining us there.